Welcome to our live stream of spine surgery here at Deuk Spine Institute. It's February 8th, 2024. I'm Dr. Deuk Majan, CEO and founder. Our patient is here because he has degenerative disc disease and spondylolisthesis or slippage of a bone, but primarily he has annular tears with herniated discs at C344551, 3 discs. Number 4-5 is particularly bad. To me, it's the worst. We're going to be first accessing those discs. Shot. Access means to get to those discs. And then we're going to fix them. So we'll see how that goes. The worst is number 4-5. You could see some slippage. Jordan, show us the slippage of 4 on 5. He's had back surgeries already, multiple back surgeries. Dr. Berndes mentioned. He's correct. And they didn't work. So he's here for the Deuk laser disc repair. Hopefully this will fix this problem once and for all. I expect it will. Shot? All right, so we're just heading to number L3-S1, the bottom disc. AP, his spine is very posterior. It's in the back, close to his skin. It's not very deep. Some patients, it's very deep. All right. His is not deep. It's what we call superficial, but I don't want to say superficial because it sounds, to some people may sound odd, but superficial in our terms as surgeons means close to the surface of the skin. Shot? To one of the body's surfaces. All right. We're going to get there eventually. We want to do it safely. Shot? The patient is currently sleeping. Shot? Just almost there. That looks good. Shot? That looks like we got it. AP, I'm checking side views and front back views of the spine using an x-ray machine. That's the standard of what we do. That looks pretty good. You can see the pedicles of L5 and S1. That looks really good. So L5-S1 happens to be the most difficult disc to get to. AP. We're just at the back of the disc now. Thank you. That's perfect. So the window of to get to L5-S1 is very small. It's not a big window. If you have questions, feel free to type them up. We're going to be fixing 3 discs through hopefully 1 incision. Shot, how's he doing? AP, oh, oof. All right. Yeah, we're just underneath the nerve root here. And let me know when he's fully awake. Shot?
How you doing, my friend? You all right? You okay? Open your eyes for me. You're
Shot?
doing great. How are you?
I'd like to have the patient fully awake as I pass through the foramen. Shot? Now this right here is going to be challenging. This is the L4-5. Shot? Shot?
All right. Open your eyes for me.
Shot? When I say shot, what I'm telling my Jordan, my x-ray technician, is to take a picture. Remember, he's had prior back surgery, so AP, there's some scar tissue here that we're dealing with, and bone spurs. His disc is pretty collapsed at 5'1".
It's 10 out of 10 pain. With morphine.
All right. Shot? I feel the herniation right there. You okay?
How you doing, my friend? You all right? You open your eyes for me? Could be the residual.
Shot? Henry, let's show the audience, why do these disc injuries cause so much back pain?
Open your eyes for me. Good. We're going to ask you some questions, okay?
All right, welcome back. You can see on our video why herniated discs cause back pain. And shot? We've gotten into the 4-5. 5-1, we're right at the back. And the reason I'm having trouble is these discs are collapsed, but they're also been operated on, so there's a lot of scar tissue, bone spur. We're going to get past it eventually. Oh, there we go. So I did 5-1. I just have to get 3-4 now. Sometimes I'm not able to get into the disc.
How you doing? You okay?
You all right? All right. Sometimes I'm not able to get in the disc because the patient just so tight. Their back muscles tighten up, they collapse the disc, they press down on the needle and they keep it. They kind of crimp down on it, keep it from going in. Huh? No, not right now. Shot. Then we get our patient to kind of go to sleep, and then we can get in there. Is he awake?
How you doing, my friend? You okay?
Shot.
You all right? Good.
There's
You
the
open your
first.
eyes?
How bad is that on a scale of 1 to 10?
Give us a number. I couldn't hear you. What number?
How high did it go?
Gotta talk a little louder.
Oh, it was 4 or 5. That was pretty
What
bad.
number? 10?
All right, 10 out of 10, 045. Is that where you get your pain?
Is that where you're getting your pain?
Yeah. Here we go, 5-1 shot. Yep. How bad is that on a scale of 1 to 10? How bad is that on a scale of 1 to 10?
Give us a number.
10. So 4, 5, and 5-1 are 10 out of 10. Who's writing that down? And then 3-4, I'm not able to test because we're not in the disc.
Destiny, you want it?
We're right at the back of the disc. We're ready to go to 99. At this point, I've accessed with the needle into the 4-5 disc, which is the worst one. 5-1, bad as well. He had 10 out of 10 pain at both places, concordant. And the only one I couldn't get into was 3-4 because he's just too tight. His muscles are so spasmed, and he's got all this scar tissue from his prior surgery. So I'm going to get into that 3-4 near the end of the case. We're going to do that one last. And by then he'll be asleep and relaxed. So we'll be able to get in. Shot? All right. Our guide wire is in place. Shot? This is 4-5, correct, Luis? It looks like it, yeah. We're going to start at the worst disc, which is L4-5. Any questions, Henry? Stay still. You're doing great.
No current questions, but we do have a comment. This comes from, forgive me if I've mispronounced this name, Party on YouTube. And they asked, or they just commented, please send email ID, sir.
Email ID. Not sure what that means.
I don't know either. I assume they're asking for the email address to contact you personally. That's would be.
Yeah, I don't give my email out to anybody, so.
No worries.
Sorry. That's not going to happen. Not sure what you want, but if you're interested to find out if you're a candidate for this type of surgery, my advice is go to our website, fill out the MRI review form, submit your MRI images and report, and then you can meet me and find out if we can help you. That's what this patient did. Wait. He did the same thing, and here he is getting fixed today. Unfortunately, I don't just give my email out to everybody. Now, my patients that I operate on have my phone number, and they're able to contact me if they need me. All right. All right, we are, He's fine. No, he's fine. I need you to take me deep.
I can do it. Whatever you need. It would be good, maybe a little IM tour. How do you feel about that? Intramuscular.
Sure. For me, why not?
Thinking maybe for the.
I think that'll help, right?
Do you want evocative discograms on the last case?
I don't know.
Get all
Why?
the levels on.
Shot? Why?
I was just asking. He's a bigger, 300 pounds.
No.
Nice guy. 360.
Where is he from?
Georgia. Just a big guy.
I'm just not sure I'm able to do that today. I'm kind of at my limit. I'm going to go take a look at him, and I may have to postpone him.
He's 5'11". I think he's 5'11".
Thought he was 4 levels.
4 levels.
Still 4 and a big guy. All right, we're in at L4-5. I wish somebody would have told me. But nobody told me. I know. But nobody told me. I mean, normally I wouldn't have a problem with it, but these are not normal days. Not for me. Not at all. Laser. All right.
We have a question.
Sure.
This comes from Betty on YouTube,
Hi, Betty. Welcome to our live stream at Deuk Spine.
asking, when you say his disc is collapsed, what exactly does that mean?
It means the spacer is dried up and collapsed. Exactly what I say. It's no trickiness about it. It's very simple. The cushion between the bones is collapsed. It's like a flat tire. It doesn't do anything. It just makes it harder for me to do my surgery. Doesn't make it impossible, but it makes it harder for all surgeons to do their surgery. So,
But you can have a desiccated disc also asymptomatic, is that
yeah,
correct?
yeah.
That's the way I
Lots of people have collapsed disc. They have 0 symptoms. Our goal is to make his collapsed disc asymptomatic. That's what we're trying to do. And we should be able to do that. These are the herniations, by the way, that have been taken out. These are the worst ones. This is L4-5. Now the reason they're here is, remember, first thing I did was I pushed the herniation back. I pushed it back into the disc. And yeah. Good question. That's what collapsed degenerated means. Degenerative disc is a collapsed disc. Everybody gets them. At the age of 45, everybody has a degenerated disc. Everybody has trauma to their spine. I'm sure there's an exception out there that doesn't, but at least 90% of people have a bad disc by the time they hit 45. Has nothing to do with aging, has to do with living. All right. This patient, he didn't just have a collapsed disc, his bones are sliding on each other, sliding forward. And that sliding is called spondylolisthesis. Most spine surgeons will have to do a fusion, but because of the way we do this surgery, we don't have to do a fusion. We can do it without a fusion. God damn it.
We have a comment and or seeking advice.
Sure.
This comes from, forgive me if I mispronounce this name once more, this comes from Civiwe on YouTube.
Hello there.
They ask, my facets has arthritis and I have I had a lumbar rhizotomy, but still I had a lot of pain. I am in South Africa, Cape Town.
Yeah, you need to get here to Florida so we can fix you, my friend. Let me have the grabber. We can get rid of your facet pain, if that's what you have. But I think the worst thing you could do is try to diagnose yourself. Even I have a hard time diagnosing some people, and I'm an expert. So we're happy to take a look at you and figure it out. Who has the last patient? Huh? Yeah. No. Who's the scheduler? I need to talk with Kim. Henry, will you grab Kim?
I can call her. Yep,
Bring her to the conference room.
no problem.
I don't know, Berndes. You know what I mean?
We did one side completely. It's doing great. Now it's the other side.
It's a DPR or a deal there? Yeah, I don't necessarily remember. But you know where I'm going with this. Tell her to come to the conference room, Henry.
No problem.
And then let me know when she's there.
Copy that.
Any other questions?
No current questions.
All right, just about done. You can see the listhesis. You guys see that? One bone is further forward than the other. There's a herniation right there. That's the same herniation that was pinching his nerve. Now, that's only one of the many pieces of it, but he had several pieces pinching on the nerve. That's one of them. You guys see it right there at the base? I'm gonna get it. I haven't gotten it out yet, but it's right here. That looks good. There's the nerve. We're looking at the bottom of the nerve right there. Let me just zap that right there. That's the herniation below the nerve. And just a little bit left. I want to get as much as I can. I told the patient, you know, we can't get all the herniation. Nobody can. The only way to get 100% of the herniation is a cadaver. And we're not going to make this patient into a cadaver. Look at that. See that thing just slip out? Grab her.
It's a big piece there, huh?
Huh?
That's an impressive size, huh? Pretty good size.
Yeah, but what it shows is multiple fragments, you know. Again, everyone thinks the herniation is one. It's more like 20 pieces. I just don't see any more. I'm under the nerve right now. I don't see any more. I don't feel any more.
I just called Kim. She is at lunch. She'll be back soon.
Yeah, no worries, thanks. All right. I think that's it for this one. I don't see anything more that I can remove. And the nerve looks pretty well decompressed. Yeah, that should have done it.
Alright, 2 on please, thank you. Jump on, thank you.
Thank you for your concern. Huh?
I'm so ahead already.
No, I like that. Yeah. Son of a bitch. Let's get that. Yeah.
Go a little deeper for you. Is that all right?
For me? No.
No, patient. You want to try to go again?
I think we're fine, right?
Oh, you did drop it. Oh, yeah.
Huh?
Oh, it dropped in that one level that you said was a little tight.
Oh, we'll be all right. I got 2 needles in. The third one, the last one, is the one I'm worried a little bit about. But we'll be all right.
If you need to go deeper,
I'll let you. I don't think we need to right now.
all right. Last thing you need to be is challenged right now.
Yeah, I understand. I'm already challenged enough. All right. Little pressure here. So we're done with one disc. Have we shown both educational videos?
I think we only showed the first one. Yeah,
Let's
just
show the second one.
no problem.
Okay, welcome back. Pull the guide wire back a little bit. Just a little bit. Go ahead. Yeah, it's probably pinched, but. All right, shot. Get it out, get it out. All right, that is not. Yeah, all right. Let's try that. Okay, so you've seen how discs cause back pain, also leg pain through inflammation, and you've seen how the Deuk laser disc repair works. Let's take the middle out. We still have to try to get our needle into number 3-4. With him asleep enough, we'll be able to do it. Yeah. But even if we don't, we'll get it when we put the dilator in. Go ahead, Jordan, get out of there. Come on. Start doing it while Luis is working. Don't wait. Alrighty. Here we go. Now this one is a bit of a mess. Look at that. Totally collapsed disc. No problem. Not for the Deuk laser disc repair. We're still going to remove some calcified pieces of bone, fragments, herniation. And that will do the trick. This, we don't have a lot of work on this one because there's not much to work on. There's not much herniation. At the same time, it still hurts him. This is a painful disc. We verified that with the discogram earlier. If you were here earlier, you saw that he had 10 out of 10 pain. Some of these patients' discs are so collapsed, they literally will crush the tube. And I apologize for the poor visibility. There's pieces of herniation floating up. You can see them going past the camera.
We have a question.
Sure.
This comes from Betty, once more on YouTube.
Hi, Betty. Welcome to our live stream.
They
Robert?
they asked, I did hear you say he was operated on before.
Oh, yes, he was.
If okay, what surgery before seeing you was that?
This patient had laminectomies done. Laminectomy, microdiscectomy by another surgeon, not me. And they didn't work. I mean, not long term at least. They might have felt better for a few days, a few weeks. But he actually got worse after the other surgery. So he's here for us to fix. Take it. And I'm hoping actually, maybe I can see a little better with this. Yep. I got another minute on this one. And then I'm gonna go for number 3-4. And I think we'll get it. Great question though, thank you. Yeah, the problem folks is that these surgeries these other surgeons do, they know they don't work. They do them anyway because they don't work about 50%, 60% of the time. And when they do work, they're temporary. But that's better than doing nothing. So that's why these surgeons will offer surgery that works 50% of the time. Because there's nothing else that does work better, except for this surgery. This surgery is the only surgery that actually works 99.6%. We've looked at the numbers. We've never had a failure.
Thank you.
It's clogged. It's pushing everything in. It needs to be unclogged. Good job. One more to go. This surgery has never failed. We've been doing it now for 17, almost 18 years. We've done 1,900 patients. We did over 320 patients just last year. And the average result is 99.6, whoa, percent. Come on, Jordan, get in here. Start moving. 99.6% of the pain in the back goes away with the surgery. Haha, I'm right there. You can see the needle bending. It's so funny. So we're right on the lip of the disc. And no.
Oh. Do you have a guy one there, please? Open it, please. Thank you. Yeah.
By the way, the whole surgery is done through this little cut. Now we did a little bigger cut this time, not 7 millimeters, but about 10 millimeters. Still going to use a little staple, and that's all he's going to need. By the way, the next, huh? Yeah, I'm not doing that today. I'll come talk to him, but we're gonna have to reschedule. I just can't. That's not next week. The week after, we'll put him on. I just can't. One of my attendings once told me, you have to figure out when you have to, huh? No mas, right? When you have to just heal yourself. Henry, any other questions?
No current questions, but we do have a
John?
comment or seeking advice. This comes from Irshad
Don't need that.
on Facebook.
It comes from who?
Irshad on Facebook.
Irshad. Nice.
And they ask, "Hi doctor, how are you? I have a L5 problem and I have pain in my lower back and legs."
Shot? Yes. Well, we can help you, Irshad. We just need you to do your MRI review. If you do the MRI review, I can review your MRI with you and see where your problem is and how to fix it. Man, you talk about a collapsed disc. You see that?
Yes, we do.
That's incredible. So his disc is so scarred. He's had so much inflammation from the herniation. He's had surgery before. The surgery has made his situation worse.
That's what he reported.
Yeah. He's got massive inflammation. Massive. And it's literally like super glue. It's glued the bones together. And I'm trying to get in there and clean that out. You may want to come over here, Luis.
Yeah.
Where's the... Yeah, come on over here. This poor man has been in suffering and pain. So the other surgeons have just made matters worse. I tell people, stay away from laminectomy, stay away from microdiscectomy, stay away from fusions and artificial discs. We spend half of our time doing surgery on patients who have had these other surgeries, and they're worse. And now it makes our job much harder. Much, much harder. Thank you, Luis. All right, so this disc, that's why I couldn't get the needle in. It's not just collapsed, but it's scarred together. So I don't know, we'll see, we'll take a look. Oh, you didn't get it. Uh-huh. I thought you had it. Wait, before you do that. All right, really? Let me see. Let me get in there. Where's the hammer? You might want to try giving a little hammer. There may be a little a little disc material. Shot? Huh? Let's see. I may have to hammer the dilator in a little more. Move your hand. Yeah. That moved it. So that should be helpful. You got them a little deeper, or? Yeah, that's fine. Here, take this. Before you do that, I don't want to destroy that yet. Pull your, well, I guess keep the fluoro there. All right. Just what I need, a little cold welding today.
Yeah. Ah, even when you're hurt.
Whew.
That's how you prevent a frozen shoulder.
That's my therapy, right? I love it. Luis has got a positive attitude. I love that. All right, folks, last one. And I got to admit to you all, I'll be out next week. So there won't be any surgery to watch for all you diehards. Look at the inflammation. You guys see all the pink?
Yes,
and
we
red?
do.
That is not normal. That is a very inflamed disc. Look at the herniation. Here it comes. Wow. Hey, you know, I'll take the little things. What do they call it? The little blessings in life, the little pleasures. The herniation's right there, right for us to grab. At least God has been kind enough to let me have the herniation right here. All right.
We have another question.
Uh-huh.
This comes from Irshad once more on Facebook.
Hello, Irshad.
Asking, I'm from Pakistan. How do I connect with you, Doc?
You fill out the MRI review form and you upload your MRI or send it to us by FedEx. That's how you connect. There is no other way, Irshad. Very nice to meet you. By the way, a lot of herniation here. So even though there was a ton of scar tissue, there's still a lot of herniation, which of course that's the basis for the inflammation which causes the scar tissue, is the herniation. All right. Doctor, 5 minutes. We keep taking pieces out, lots of them. The good news is, I think he's going to feel a whole lot better. And that makes me happy. Another piece of herniation. You guys see that? The other surgeon just left all this here. Look at the size of that. That was a big one, the size of a small grape. That was pushing on his nerve, by the way. So many pieces. Come on, Luis. Oh, wow. Yeah, we're right at the exit of the disc. That's fine. We're just about done. You guys see that inflammatory tissue, that pink stuff I just zapped?
Yes, we do.
Uh-huh. That's what the other doctor left. That's why this poor patient still had so much symptoms. Because the other doctor never did the right surgery and left so much herniation here. Grab her. Scope use will be 7. There it is. Look at that thing. Huge. I don't want it. We're just going to keep going. I think we're done. I think that was it. I didn't see any more. No. That's just, there we go. Tiny little piece. But everyone counts. Every one of these can cause pain, suffering. And we want to end this man's suffering the right way by fixing his affliction. All right. 2 minutes. There's some fat. If only he had come to me first, he wouldn't have had all this problems with scar tissue, ongoing inflammation, incapacitating pain in his leg, his back. 30 seconds. But alas, he went to another surgeon who just wanted to do invasive surgery. That's where all the big bucks are. Invasive surgery. All right. Last grab.
Sitting on actually. Thank you. Scope off.
Thank you, Luis. Great job today, everybody. Good work. Well, that's our last case for today. Huh? Yeah. Thank you for doing such a good job. Yeah, that's wonderful. Yeah, those herniations were pushing right on her spinal cord. They were deep in there. You ready? Oh, yeah. Oh, all done. Great job, everyone. Thank you. I'm going to go talk to the next person and just let them know what's going on. All right, Henry, feel free to end the live stream.
Copy that.